Many people over 60 live with daily stiffness that slowly steals their comfort balance and confidence. The problem often is not getting old, but ongoing inflammation and weaker circulation building quietly over years. Today's video is educational health information, not a medical diagnosis and not personal medical advice. If you use blood thinners, have clot, history, liver disease, kidney disease, or severe bowel problems, ask your clinician first. We will walk through castor oil in a clear ranking from minor effects to the strongest, most practical effects. Some claims online are exaggerated, so we will separate what seems supported from what remains uncertain. You will also learn safe methods, common mistakes, and the few situations where castor oil is not appropriate. If you stay to the end, you will have a simple plan you can follow carefully without risky shortcuts. After 60, your tissues recover more slowly, and small inflammation can linger much longer than before. Stiff joints can reduce movement, and less movement can worsen swelling, weakness, and circulation over time. When blood flow slows, your legs may feel heavy, your feet may swell, and your hands may feel colder. That cycle is common, and it often happens even when routine blood tests look mostly normal. What people call age is sometimes a treatable pattern of sleep loss, low movement, and persistent inflammation. The goal is not perfection, but steadier comfort, safer walking, and fewer painful mornings during the week. Castor oil will not replace medical care, but some people use it as a supportive home routine. We will keep the language simple, the claims careful, and the safety notes very clear. Castor oil is a thick plant oil, and its key fatty acid is called rhodanoleic acid. In laboratory and clinical literature, rhodanoleic acid is discussed for its effects on certain prostaglandin pathways. One well-described example is the laxative effect, where ricinoleic acid can activate EP3 receptors in the gut. That is why oral castor oil can trigger strong intestinal contractions, sometimes within a short period. Topical use is different, and evidence for deep detox claims is much less solid and often overstated. Some cancer and medical education sources warn that liver detox marketing language can mislead vulnerable patients. There is also a small body of older research on castor oil packs and immune markers, but it is not definitive. So, we will focus on practical comfort goals, and we will avoid magical claims that cannot be verified. Think of this ranking as a menu, not a checklist you must complete all at once. Pick one goal that matches your biggest struggle, and do that one carefully and consistently. If your biggest struggle is constipation, you will need the strictest dosing rules and the strongest caution. If your biggest struggle is leg swelling technique and fall prevention will matter more than anything else. If your biggest struggle is stiff knees and fingers, gentle heat routines and safe movement should still come first. Castor oil may be added as a supportive step, but only when you can do it safely. Now, let's start with the smallest benefits, so expectations stay realistic and trust stays strong. 10. Skin softening. Age spots and small skin tag support. Many people first hear about castor oil for dark spots, rough patches, and small skin tags. As a heavy oil, it can reduce dryness, and that alone can make skin look calmer and smoother. Some reviews discuss modest changes in pigmentation with repeated use, but results are typically small and slow. If you expect decades of sun damage to vanish, you will likely feel disappointed and stop too soon. A safer expectation is improved softness, less cracking, and slightly more even-looking texture over several weeks. If you have thin skin, avoid scrubbing hard because friction can create tears and invite infection. Never pull, cut, or scratch a skin tag at home because bleeding and infection are real risks. Use warm water, a soft cloth, and gentle pressure, then moisturize and stop if burning appears. 9. Eyebrow or eyelash fullness. Castor oil is popular for brows and lashes, and many people report a fuller look over time. The most realistic explanation is reduced breakage and better conditioning of hairs that are already growing. If a follicle is dormant from age-related hormonal change, a topical oil is unlikely to restart it. That does not mean it is useless, but it means results depend on what is still active. If you try it, apply a very thin layer with a clean wand because thick layers can migrate. Oil drifting into the eye can cause irritation, blurry vision, and morning discomfort that scares people away. Apply it earlier in the evening so it absorbs before sleep and keep the application light. Stop immediately if redness, itching, swelling, or vision changes appear, and consider speaking to an eye professional. 8. Gum comfort breath. Support. Some people use oil pulling as a traditional mouth routine for gum discomfort and breath. The idea is that oils may disrupt some plaque and bacterial films, supporting cleaner feeling gums. Some small studies and reviews suggest gum markers can improve, but protocols vary, and evidence quality varies. The biggest real-world problem is taste and tolerance, because many people gag and quit quickly. Another concern is dental work, because oil pulling can loosen adhesives for dentures or bridge materials. That can become expensive and painful, so this routine is not a good fit for everyone. If you try it, swish gently for a short period, spit completely, and never swallow large amounts. If you have persistent gum bleeding, loose teeth, or severe pain, a dental check matters more than any oil. 7. Leg swelling, varicose vein, discomfort. For many older adults, the most frustrating symptom is heavy legs and ankle swelling by afternoon. When calf muscles weaken and you sit longer, your natural pump for fluid return can slow. A gentle upward massage may help fluid movement, and castor oil can reduce friction during massage. The key is direction, because you should massage upward from ankle toward knee, not downward or randomly. This mimics lymphatic and venous return, and it can feel soothing when done patiently and lightly. You can also combine this with ankle circles and short walks, because movement is the best pump. Now, the biggest safety point is slipping, because oil on feet can turn floors into a fall hazard. Apply while seated, wipe excess, and use grip socks before standing, because falls after 60 can be devastating. 6. Stiff joint. Many videos claim castor oil dissolves bone spurs and removes calcification, which is too absolute. What is more realistic is that warmth and gentle compression can reduce discomfort and improve flexibility temporarily. Some people also report looser joints when they use a warm pack with castor oil consistently. A classic method is a castor oil pack using a cloth, soaked enough to be moist but not dripping. Place the cloth on the stiff area, cover it with plastic wrap, and apply moderate heat carefully. Avoid overheating, because older skin burns faster, and burns can create serious healing problems. Never microwave an oil-soaked cloth, because heat becomes uneven and can cause sudden skin burns. If you take blood thinners or bruise easily, ask your clinician before frequent deep heat routines. 5. Nighttime relaxation. Many people over 60 struggle with waking at night, racing thoughts, and shallow sleep. A calming bedtime routine can help even when no single product is a miracle on its own. Some people rub a small amount of castor oil on the abdomen as part of a relaxing ritual. The benefit may come from touch warmth and consistent timing, which signals safety to the nervous system. If you try it, use a small amount, rub gently, and keep your breathing slow and comfortable. Protect clothing and sheets, because castor oil stains fabric easily, and stains can create frustration. Use an old shirt or towel barrier so your routine stays pleasant instead of becoming a chore. If sleep worsens, anxiety rises, or skin becomes irritated, stop and return to basic sleep hygiene. 4. Cold hands, numb toes. Many older adults notice colder fingers, tingling toes, and legs that feel heavy near evening. Sometimes that is simple circulation slowdown, but sometimes it can be a warning sign of vascular disease. If you have chest pain, sudden weakness, severe calf pain, or one-sided numbness, seek urgent care. For mild symptoms, gentle movement, warmth, hydration, and medical evaluation of risk factors are foundational. Massage with oil may support comfort, but it is not a treatment for clots, blocked arteries, or neuropathy. Be careful with bold online claims about blood clot prevention, because that language can be unsafe. If you use anticoagulants like warfarin, do not add new routines without medical guidance and monitoring. Your goal here is comfort and safety, not chasing risky promises that ignore your medication history. 3. Constipation relief. Castor oil has a long history as a stimulant laxative, and research describes an EP3 receptor mechanism. That mechanism explains why it can trigger strong intestinal contractions that push stool forward forcefully. This is not a gentle fiber-like effect, and that is why castor oil can feel harsh in older adults. The biggest dangers are cramping diarrhea, dehydration, and electrolyte imbalance, which can be serious after 60. If you have heart disease, kidney disease, or take diuretics, dehydration can become dangerous quickly. If you ever consider oral use, treat it as short-term only and start with the smallest possible amount. Never exceed typical recommended limits and stop immediately if severe cramping, dizziness, or weakness appears. For long-term constipation talk with a clinician about fiber fluids, movement medications, and safer options. 2. Osteoarthritis comfort. Some clinical research has compared oral castor oil preparations with common anti-inflammatory medications in knee arthritis. In those studies, symptom improvement was reported, but study context, dosing, and monitoring are very important. This does not mean everyone should self-dose castor oil, especially not older adults with multiple medications. Oral castor oil can upset the gut, affect hydration, and interact indirectly with fragile health conditions. A safer takeaway is that castor-derived compounds have been studied. Not that home use is automatically safe. If you want arthritis relief, combine clinician-guided care with strength training, weight management, and safe pain strategies. Topical routines and warm packs may support comfort, but they should complement, not replace, medical evaluation. If you have red-hot swollen joints, fever, or sudden severe pain, get checked rather than experimenting at home. 1. Liver detox claims. Many viral posts promise that castor oil packs detox the liver, which can sound comforting but may mislead. Major cancer education sources warn that detox language is often marketing not a medically proven liver cleanse. There is limited older research suggesting changes in some immune markers with castor oil packs, but conclusions are limited. So the safest way to present this is not detox, but a warm, relaxing pack routine some people enjoy. If someone feels lighter, sleeps better, or has less abdominal tension, that may reflect relaxation and warmth effects. It does not prove toxins were flushed out, and it should never delay proper evaluation of liver symptoms. If you have jaundice, dark urine, pale stools, severe fatigue, or right upper abdominal pain, see a clinician promptly. If you still try a warm pack routine, keep heat, moderate, protect skin, and stop. If nausea or rash appears, if you are on blood, thinners have had deep vein thrombosis, or have clotting disorders, consult your clinician first. If you have diabetes with neuropathy, be cautious with heat, because reduced sensation can hide burns. If you have fragile skin or take steroids, avoid strong heat and friction, because wounds heal slower. If you are prone to falls, never apply oils to feet before standing, and always use grip socks. If you try oral use for constipation, treat dehydration as the main danger, and prioritize fluids and monitoring. Never stop prescribed medicines because of a video, especially blood pressure drugs, heart medications, or anticoagulants. Your goal is a safe routine you can sustain, not a dramatic experiment that creates new problems. If your main problem is heavy legs and ankle swelling, choose gentle upward massage and safe walking habits. If your main problem is stiff hands and knees, choose warmth, gentle stretching, and careful packs without overheating. If your main problem is poor sleep, choose a calming nightly routine, slower breathing, and consistent bedtime timing. If your main problem is constipation, choose fiber fluids movement and medical guidance before harsh stimulant laxatives. You can add castor oil only as a helper inside those bigger foundations, not as the foundation itself. Small daily steps usually beat big occasional steps, especially for older bodies that prefer consistency and kindness. Track one simple sign, like morning stiffness, length ankle size in the evening, or sleep interruptions at night. Write one sentence daily, because your day one memory will fade and your journal will show real change. You are not weak because your joints complain, your legs swell, or your sleep has changed with age. Your body is giving signals, and many signals improve when inflammation calms and movement becomes safer again. Castor oil is not magic, but it has specific studied properties, and it can be used thoughtfully by some people. The most important part is doing the safe basics, then using any add-on routine gently and consistently. If you want a next step, choose one goal. Tonight, set up a safe space and remove slippery hazards first. Your independence is built from small, stable habits, not from bold claims that make you anxious. If you found this helpful, share your main struggle like swelling, stiffness, sleep, or constipation in the comments. We will keep making clear, evidence-minded health education that respects older adults and prioritizes safety every time.